This is Dr. Marlon Schul, and I'm going to discuss a healthy vein message in assessing blood clot risk as well as some vein facts. This is the start of a public service message, if you will. Did you know that 10 times the number of people suffer from venous insufficiency versus peripheral arterial disease? The image to the right shows a small saphenous vein in the calf that cannot be seen by the naked eye, a very dilated vessel that was leading to painful swollen limb in a patient. This is something that if you're having heaviness, aching, itching, throbbing, or swelling, you may have a vein problem. Did you know that all age groups may be affected by venous insufficiency and/or venous disorders? This is an example of a child with a disorder known as Klippel-Trenaunay syndrome, a deformative syndrome that is fraught with venous and lymphatic malformations as well as bony deformities. Did you know that venous leg ulcers affect approximately 500,000 patients at any given time, and that there are 20,000 new stasis ulcers per year in our country? This puts a great burden of cost on our society and is something that is just now being further recognized as a big burden on our healthcare budget. Did you know that 1 in 20 or 5% of people will develop a blood clot in their lower extremity or pulmonary embolus over their lifetime? Did you know that over 500,000 people are hospitalized for DVT or pulmonary embolus each year? With the understanding that patients who present with DVT that can be in compression and walk and take an oral medicine, that number is changing. The incidence of blood clots is not changing, but the management is changing, where more blood clots are being managed as outpatient because it's safer for patients and they do better. Did you know that fatal pulmonary emboli represent the third most common cause of death among hospitalized patients? This is an example of a post-mortem lung that had a fatal pulmonary embolus. The reality is, by blood clot risk assessment, the incidence of this process may be minimized, and an arguably hospital death among patients due to pulmonary embolus should have an impact just by risk assessment. So those that do survive their blood clot, it's found that many of them could have been prevented just by doing a risk assessment, and that nearly half of them failed to receive any prophylaxis. That means either compression sleeves on their legs and or some form of pharmacological means or medicine to help prevent the blood clot. What you see are patients like this who survive. They've got painful, swollen, discolored limbs, and they're fraught with chronic pain and swelling. This is an example of post-thrombotic syndrome for someone who lives through the event. So this is a public service message. There's been a lot of effort put into building awareness of DVT and the incidence and its effects on society. In 2005, the U.S. Senate passed a resolution declaring the month of March as National DVT Awareness Month. March is actually a month where we participate in screening processes just to help bring further awareness to this. And just to show additional focus, Joint Commission and CMS is Center for Medicare and Medicaid Services. They've declared blood clots and or pulmonary embolus as an area of concern due to their incidence and how it changes people's lives, obviously, not to mention mortality. And they've coined the term never events, identifying certain areas where blood clots should never exist. So this is our first in a series of YouTube educational presentations, and this one's titled Blood Clot Risk Assessment. Bottom line is that there is a tool that you can use whether you have an iPhone or an iPad. This is a free app called the Caprini score. Dr. Joe Caprini has spent over 30 years of his career honing the significance of various risk factors for patients who may or may not develop blood clots to help identify a specific tool that can be extrapolated to both medical patients, surgical patients, and just help patients identify what their given risk may be for developing a blood clot. The app is intuitive, it is simple to administer, And I would encourage anybody who's concerned about blood clots who's watching this right now to go to the App Store so that they can actually follow along with this talk. So once you open the app, it comes to this page. It just simply shows what the reality is with over 17,000 patients used to initially develop this tool. That number is far greater today. And it's endorsed by the Chest Consensus Guidelines. These are guidelines produced every 4 years by the American College of Chest Physicians, the experts, if you will, and specialists who use the epidemiology and the current literature to help identify best practices for blood clot management, and in this instance, blood clot prevention. So you click Start Survey and you go to the next page. Now this is probably the easiest page. Your age is your age and your natural gender is your natural gender. So you basically put a finger on those two bars and you click Continue. The next page actually very specific things, but they're really referring to things in the last month with the exception of spinal cord injury. So if you've had an elective hip or knee joint replacement surgery in the last month, a broken hip, pelvis, or leg in the last month, any serious trauma, major car accident, fall within the last month where you may not have been so mobile, or if you've experienced a stroke in the last month, you click yes. Now, if you've had a prior spinal cord paralysis, you click yes to that as well. Once you click Continue, you come to the next page. This is an example that carries, again, weak risk with each one of these, but if there's minor surgery planned less than 45 minutes, you click that button. If you have had major surgery more than 45 minutes in the last month, you click the corresponding button. If you have visible varicose veins, now this is interesting because varicose veins by themselves can develop into a superficial thrombus, but the presence of varicose veins in patients has been shown to increase the risk of developing blood clot, particularly in elderly hospitalized patients. So you would click this button if you have visible varicosities. Any history of inflammatory bowel disease, that's Crohn's disease or ulcerative colitis, also increases your risk. And then the issue of swollen legs. As patients become less mobile, they tend to have more swelling. Less mobility increases the risk of developing a blood clot, but in this instance, swelling of any kind. If you're having swollen legs, you would click that button and then click Continue to go to the next page. So in this page, I think the first button, we're in Indiana. The average BMI of patients in my practice is 33.5. I think it's just kind of a part of our society. We've just generally gotten bigger. So the majority of people, if you're not a thinner individual, you're going to click yes to this because the majority of our people in Indiana do exceed that 25 mark. Now, if you are under the impression that your overall weight is higher, we do know that the BMI greater than 40 increases the blood clot risk threefold. So as you click this button for yes, recognize that if you're considered obese, that you may actually have additional risk beyond what that 1 point may give you. Now, the rest of these are chronic diseases, but if you've had a heart attack within the last month, congestive heart failure in the last month, or serious infection, you go ahead and you check those boxes to yes. And then if you've got a history of emphysema or chronic lung disease, you also check that box, yes. And then hit Continue. So page 5, very specific questions. If you've been on bed rest or restricted mobility, including a removable leg brace for less than 72 hours, you click that box. If you have a current or past malignancy, excluding things like basal cell carcinoma, you check that box. If you have planned surgery lasting longer than 45 minutes, including laparoscopic and arthroscopic surgery, you press that box. If you have a non-removable plaster cast or mold that has kept you from moving your leg within the last month, you check that box. If you have a tube in a blood vessel in your neck or chest that delivers blood or medicine directly to the heart within the last month, also known as a central line, You check that box and then click continue. I believe this is the most important page, and it's something that is often overlooked as patients are risk assessed for surgery. If you have a personal history of a blood clot in your legs or pulmonary embolus, it increases your risk by far. It's one of the most significant risk factors. Similarly, if you've had a sibling or a parent that has developed a blood clot, you may have that same risk of developing a blood clot. And again, we're talking blood clots in the legs, arms, or blood clots in the lungs. Any family history of a positive blood test indicating a risk for blood clotting, you would also check that box. And when you think about that, roughly 5% of walking, talking Americans have something called factor V Leiden, the most common clotting disorder. Oftentimes it's not identified until after someone has had an event. The last item here, which was the top one, if you've been confined to bed for 72 hours or more within the last month, that also would be a risk, and you would click that box. When you're done with that, you hit continue to the last page. And here, if you're using hormonal birth control or any hormonal replacement therapy, that carries a risk of developing a blood clot. If you are pregnant or have had a baby in the last month, sadly, those are times where the risk of developing a blood clot is greater than when they're not evident. So you would click that box. Now, historically, if you've had an unexplained stillborn infant, or if you've had recurrent spontaneous abortion more than 3 times, or if you've had a premature birth with toxemia or a growth-restricted infant, you would check that box. Now, when you click the results button at the bottom, it will take you to the next page. This is where the results matter. If it tells you that you're low risk, well, what that means is that if you maintain your level of walking and let's say you had a minor surgery and you got up and you were able to walk right away, you're increasing the blood flow and you probably aren't going to have a problem. If you're intermediate risk, I think it comes down to what is the appropriate approach. In many instances, a simple compression stocking or getting up and walking is all you need. In other instances, even though intermediate, there may be additional concerns that may put you at risk where you can't get up and walk, in which case a prophylactic dose of a blood thinner like rivaroxaban, apixaban, or low molecular weight heparin. Trade names for those would be Lovenox for low molecular weight heparin, apixaban is Eliquis, and rivaroxaban is Xarelto. There are prophylactic doses for these that are better than nothing and have been shown to be very helpful in reducing the risk of blood clot, particularly after total joint procedures. And this should be considered. But any procedure, any medical illness that puts somebody at bed rest places someone at risk. High risk, that really involves paying attention to that, recognizing that if you're in a situation where you're heading down a path for surgery or you are not so mobile, you may want to take some effort or some measures to help reduce that risk, because the least mobile you are, we certainly know that immobility will contribute to clot risk. It just increases the risk of having that blood not move in the lower extremities. So things like compression stockings or even devices to help squeeze the calf may be quite helpful. What we know for sure, and I think these are the take-home points, is the blood clot risk is personal, and nobody can look at you and you cannot tell your risk merely by your age or general health. The Caprini tool is a very useful system by which it's validated, and it's useful in nearly every aspect of medicine. The personal history and family history of blood clots in the legs or lungs are strong risk factors for developing a new clot. If you don't know your family history and you're concerned about that, it may just take a simple phone call to get that information. Recognize that blood clots do happen, that clotting disorders have a prevalence of roughly 5% in the general population. This tool is to help you identify your risk before a procedure or before a hospitalization, or if you have a concern that somehow right now you may have a blood clot. Well, I hope that you found this presentation useful. I would strongly encourage you to uh, do your own risk assessment. And if you've got a family member or loved one that is concerned, it's a simple tool to employ. Next up, in the coming weeks, we'll have vein symptoms and principles of healthy vein habits. These are also ways to recognize whether you have a vein problem and how to keep yourself from having problems. If you want to learn more about us, visit our website at www.lafayetteveins.com to learn more about your vein health and other fascinating information, or contact us at 765-807-2770 to learn more about your vein health. Thank you for listening.